Hi guys, Dr. H here, your source of advanced musculoskeletal care, and today I want to talk about interpreting pain during exercise. You've heard the statement, no pain, no gain. Is it true? Let's talk about that. So one of the things that I do quite often with my patients who suffer from chronic musculoskeletal problems is prescribe them exercise regimens. Either I'll prescribe them particular exercises to do, or I'll just generally say you need to start doing more strength training exercises or range of motion exercises, what have you. And probably the number one question that I get is, well, doc, sometimes when I do a certain exercise or a certain type of exercise, I get a certain amount of pain, and I don't know if I'm making things worse or if this is pain that I'm able to work through. So that's actually a great question because you can do both with exercise. There are certain pains that you can absolutely work through and are part of the recovery process. There are also certain pains that if you experience during an exercise routine, it's cause for concern. You might need to get that further evaluated. So let's talk a little bit about general guidelines to follow when exercising and experiencing pain. So like with all guidelines, these are not by definition specific to you, whoever's watching. And if there's something that's concerning enough to make you not want to exercise, then it's absolutely appropriate to bring that up with your physician and get further evaluation. The problem that I have is I've seen a lot of physicians, a lot of healthcare providers say to patients, well, if it hurts at all, don't do it. Right? It's almost the old joke at this point. Doc, it hurts when I do this. Oh, don't do that then. And that's actually kind of bad advice. There's been some studies showing that even a little bit of discomfort during exercise can actually be more effective than those completely pain-free routines, because usually when you're exercising an area that needs strengthened or improved, you're going to have a little bit of discomfort. So I want to break this down into three general categories: the characteristic of the pain, the duration or how long this pain lasts, and the pain's effect on your function or mobility. So in terms of the characteristic of the pain, one of the things I tell a lot of my patients is all pain hurts, sort of the definition. Not all hurting is harming something. And you can usually tell, again, usually, whether or not pain indicates that something's actually being harmed by the nature of the pain. So I think we've all felt that diffuse, burning, aching muscle pain that is always kind of present during exercise. That pain, not harmful, right? That's the pain that sort of feel the burn or feel the achiness, not usually a harmful thing. So that discomfort, that diffuse muscle burn, that's usually just the feeling of muscles working hard. There's metabolites and inflammation, that kind of thing that's going on there, but that pain is part of strengthening and training up your musculature. Pain that is more localized, sharp, stabbing, that could be pain that you need to be a little bit more cautious about. Now the emphasis here is cautious about, not necessarily mean you have to stop what you're doing. There are some exercises that need to strengthen areas of the body, let's just say the knee, where doing these exercises may cause a little bit of sharp, stabbing, localized pain in an area. And that doesn't necessarily mean you're harming that area. It just might mean that there's a structure in that area that's a little bit more sensitive to that pain. The important thing here is if you are getting sharp, stabbing, localized pain, it's important to know where it's coming from. So for example, if you're doing knee exercises and you get sharp pain in your knee and you know you have an old injury to the knee or some osteoarthritis in the knee and that's correlating with that pain, then you're probably okay to keep going. If you have no idea where that pain's coming from, then maybe that might be something to look into a little bit further. Finally, if you have a tearing sensation or a hard spasm or any pain that's associated with swelling, redness, bruising, that's something that is really concerning. You should stop what you're doing and get evaluated. Anytime you get swelling, redness, bruising, you probably actually have injured something. The next category I want to talk about is sort of how long is the pain lasting. So you can get significant pain and then it immediately goes away as soon as you're done an exercise. Usually, again, that just means you're tweaking something a little bit. If you know where it's coming from, not usually too much of a concern. However, if after you're done the exercise, that pain continues, and especially if it's getting worse, if it progresses, even though you're no longer doing the exercise, that's more of a cause for concern. In the same vein, everyone has had post-exercise soreness, right? Usually it peaks around 2 days after exercising, your whole body feels sore, and then it usually is better within another couple days. However, if you're having more localized pain after your exercise a few days later, and again, particularly if it's getting worse throughout the following days, that can be of concern, and that's something that you need to have evaluated. Probably the most useful category is how it's affecting your function and your mobility. So again, let's just use the knee as an example since we started with that. If you're getting pain in the knee, but that knee can still support your weight, it has full range of motion, it feels like it has its complete strength, that's probably less concerning than if you're getting pain in your knee and all of a sudden you can't move it as much as you could before, it's not as stable, you try to put your weight on it, doesn't want to hold your weight anymore. Usually when you lose function in a joint, that's due to injury. Now again, if you work a muscle group really, really hard, for example, the muscle groups around your knee, and then try to stand on one leg, you might feel more fatigued. That's not what I'm talking about. What I'm talking about is if you try to stand on that knee, it kind of feels like it wants to buckle or give out on you. That's a sign that it's lost some of its structure, lost some of its integrity, and that may be due to an injury. All right, so just as a quick review, pain that is diffuse, pain that is more muscle soreness, even pain that's a little bit more stabbing and localized, but you know where it's coming from. Pain that goes away as soon as you're done your exercise or doesn't really last that long after the following days of your exercise. Pain that doesn't affect your function and mobility. This is all pain that you can probably be safe to exercise through. Pain that is tearing, spasming, associated with any kind of bruising, swelling, redness. Pain that lasts longer than a few days or even worse, starts increasing over a period of time or a few days. Pain that affects the function of your joint. That is pain that you need to have checked out by a doc and make sure that you didn't injure something. So as a quick disclaimer, guys, obviously as a musculoskeletal expert, I'm talking about MSK pain. Everything I just said does not apply to things like chest pain or, dizziness, shortness of breath, things that could be more related to your cardiopulmonary system. That is a completely different topic. And of course, you should always be evaluated by your physician to make sure that those heart and lung organs are healthy enough to do exercise before starting any kind of moderate or high intensity exercise routine. So with that said, hopefully this helps you as a bit of general guideline for when you're feeling pain during an exercise. Is it something you can try to push through a little bit, or is it something you need to back off of a little bit, or is it something that needs to be checked out fairly immediately? So speak with a musculoskeletal specialist if you have any concerns, and as always, keep moving.